In this chapter, we'll be looking at the drugs and drug classes that are used in the respiratory system. Other bronchodilators or things like the anticholinergics, apotropium, which is Atrovin HFA. We see the next drug class, we see theophylline, uh, uh, aminophylline, and then we see theophylline drugs, which are Theo24 and Unifil. So these are basically three different groups. Probably most commonly, a lot of the respiratory infections or respiratory problems are going to be treated by a combination of medications. So um, they may use a bronchodilator to help to open up and to clear out um, the the passageways. Then they may use an antitussive or an expectorant or a decongestant, especially with children. They may use something like Dimetap or promethazine with codeine, or basically it's very common that you would use more than one drug. It seems to be much more recent than it has been, but uh, federal legislation changed um, the class of drugs, pseudoephedrine, in 2006, and that includes our pseudoephedrine and our ephedrine. And so now what it did was restricting it to over the sales, the restriction of over the sales uh, purchase of these particular drugs. And the reason being is these were used in methamphetamine drug lab production. And so they felt that if they don't have those two drugs, then it makes it much more difficult for them to illegally create the drug. And so they may use a lot of other things and do in the drugs to create meth, but they would need one of these two drugs in order to make it work. And what this did was limit that use. After that time frame, what it does, it changes. So now to purchase anything containing any of those ingredients, you have to be at least 18 years old. You have to show an ID, and a lot of times they'll want to see a photo ID. Uh, it has to have your name, your amount purchased recorded in the logbook by the pharmacist. You can only purchase 3.6 grams a day, and your total cannot be more than 9 grams in 1 month. And along with these particular drugs, they also targeted, or at least some of the larger companies have targeted certain chemicals that might also be used in meth production and have limited the purchase of those at any one time. In chest physiotherapy procedures, you might see oxygen done, different types of products involved there. Uh, but you can see it also given by ventilator. You might see it given a part of that to be postural drainage. Um, you may also see percussion, which is striking the chest wall over an area that's being drained to help to stimulate that. And then vibration, which is fine shaking pressure to the chest wall during exhalation, helping to remove that material. Some things that we have to consider clinically. We have to explain the effects of drugs, and there are some side effects to some of these. Assist the patient in sitting or leaning position when you're seeing them as a patient in the office and they're having difficulty with positional breathing. We want to encourage them to take their drugs on time. Um, to remove the mucus from their nose and throat, and don't let it be a consistent drainage when it can be removed. Um, Tell them when the breathing gets more difficult. Um, don't rush them in giving drugs. If you're giving oxygen, if you're giving these things, you follow these patterns too. Give them the amount of fluid with medications so that they can begin the process of working quickly. If a cough is unproductive, uh, remove anything that might irritate and cause further difficulty in breathing. Some other clinical considerations is adding moisture to the air with a humidifier, especially during winter months. A lot of patients may have, their heating set warmer, especially elderly patients or older patients or those who get cold easily. It also dries out the air, so then that might help to prevent a problem, might help to give them some relief during a problem. So warn them about their medications, the drowsiness that may be caused from antihistamines. They affect people differently, and for some people, they have a very sedating effect. And I'll also mention for some patients, it actually makes them more hyper. So depends on the person. Instruct family to help them to take measures to assist the patient in breathing. If they need assistance somewhere that someone else would require someone else's help and support. If you're giving patients multiple drugs, this is an instance of how you might do that. Um, if you're giving a beta agonist such as albuterol, which is also use that as an example because that's one of the most common, you would give it first because you want it. It's a fast-acting drug. You want it to open up before you give the passages more before you use the anticholinergic, sorry, such as Atrovent. Then corticosteroid would come next. Um, One of the problems that kind of happens with a Nasocoin, your common drug here, one of the things that might happen is if you gave this first, it might actually prevent the albuterol from actually benefiting. So you do them in this order for that reason. When using oxygen for a patient, the first thing to note is you must have a specific order for the oxygen and the amount. So, kind of like you would do a prescription, you wouldn't do it oxygen without that physician's or provider's order. If you give 100% of oxygen for more than 6 hours, it can cause oxygen toxicity, which is critical also. Um, it can be administered through a nasal cannula, through a nasal catheter, through an oxygen mask. They may use an oxygen tent or a face tent. Typically, that's going to be more inpatient based or incubator or respirators, and those again are going to be more hospital based. One note I'll say about administering oxygen is it's set on liters per minute, and with patients who have emphysema, one of the problems is they cannot get the air out. It's not so much getting air in as air out. And with these patients, typically you cannot give them more than 2 liters per minute, or because their lungs cannot take it. So that's one thing to remember for sure. Pulse oximetry is the measurement that we use to indirectly determine what the patient's blood oxygen content is. We have a probe with a light and a sensor. We put it either over the nose, the ear, or the fingernail, and typically in outpatients it's fingernail. Reading usually depends on the pulse oximeter, but typically between 10 and 30 seconds. Um, and you're reading basically um, the um, indication of what their oxygen saturation value is, and a normal should be over 95%. You would not see a patient on 100 that would have a 100% oxygen um, saturation outside of being given actual oxygen, probably by mask, in fact. So you wouldn't expect to ever see a 100 on a patient with room air. That is the end of this particular chapter of pharmacology, and I will be sending you information. So you will know what to do from here.